Hey everyone, I just want to make a video about something a few people have actually suggested I make for a while. And it is about, just my mental health in general, because I've talked on here before about how my mental health, I do have a mental illness, and what I'm diagnosed with, and what medications, and therapy, and everything like that. And first of all, I just want to say, as a little, not really disclaimer, but anyway, people will always, if you're on medications, or especially psychiatric medications, they will say that it's dangerous. Psychiatrists are out to get you, and a lot of stuff like that. Personally, I don't believe any of that stuff. I mean, to me, taking a medication for a mental illness is no different than taking, if you have diabetes, high blood pressure, cholesterol problems, or heart problems, or whatever. It's no different to me. So, and I do believe that mental illness is real. Now, am I severe, like do I have schizophrenia or something like that? No, but it has deeply affected my quality of life, and I'll explain that in a minute. But basically, I'm diagnosed with bipolar 2, rapid cycling, and I'm on a total of 4 medications. 3 are medications I take on a regular basis, and then 1 is as needed, because I have anxiety issues too. It's pretty bad. I mean, I actually have, it's easy for me to look at a camera and talk, but if you feel like a bunch of people right in front of me in person, or just one person that I didn't know well, I would freak out. I would get panic. I would have panic attacks until my face turned blue. And that's the same, it's hard. I can't even get a job because of it. Driving, I'm 18, I haven't drove yet because, and this really all makes me really upset. Because I really wish I could do those things. People think I'm just making excuses or whatever. I'm not. Seriously, if you lived, like a day in my shoes, you would understand why it's so difficult for me. And so, bipolar type 2 rapid cycling, which I can have mood swings, 5 times a day. Go from, to happy to sad to irritable to angry, pissed off for no reason. And it really just, it upsets me that I even have, any of those problems. But I know, it could be much worse. So, medications, like I said, I'm on 4. And like I said, 1 that I take as needed, and 3 I take regularly. So the first one I take is Prozac, which I know most people had to have heard of. About 60 milligrams of that, and that is the antidepressant. And I don't have any of these bottles because it's a good reason I don't, because my mom, which I'm okay right now, but my mother keeps all my medication locked up in a safe, which I understand why she does that. I've had a history of overdose before. I've tried to commit suicide, not commit, but attempt suicide, at least 3 times, maybe 4 if I remember correctly. But Prozac is one. It's an SSRI, selective serotonin reuptake inhibitor, and I was really on that for the first time, and which I'm on it now. I was on that, the first antidepressant I was ever on, at 14 years old, and then it changed from Effexor to Zoloft to Wellbutrin to Lexapro, which now I'm back to Prozac again because I felt like the Lexapro quit working. And actually, one thing I don't agree with the psychiatrist, and the maximum recommended dose of Lexapro is 20 milligrams. And I was on 40, so twice the maximum recommended dose. And I was on, like I said, Zoloft for a while, Effexor, and I did 2 runs with Effexor. And then now it's on Prozac, and I feel like it's it's called the Prozac poop out, which where the drug will eventually stop working. The more you take it. I've been up to 80 milligrams, and now I'm down to 60. And I just saw my psychiatrist today, so we discussed, getting off the Prozac and maybe a new medication. The second main one I'm on is Latuda. I'm on 40 milligrams. I started out at 20, and I'm on 40. And honestly, I gotta say, Latuda is probably the best medication I've ever been on. It's not perfect. Doesn't mean it does everything for me, which no medication will do everything for you. And also, if you're, looking on taking these medications, first of all, there are side effects like any other medication, and you have to give it time. It will not work in the same day you take it. For most antidepressants, you've got to give 4 to 6, maybe 8 weeks to even start feeling any effects. And with antipsychotics, excuse me, my voice is going out. You have to wait like, usually 1 to 2 weeks for any initial feeling or effects, and maybe up to 6 weeks with full effect. I've been on Latuda for the past 3 months now, maybe, and I love it. I'm up to 40, and we've discussed going up to 60 milligrams, but I'm kind of afraid of that, because the problem with antipsychotics is they can cause a rare, it's very rare, but a side effect called tardive dyskinesia, where you have these weird muscle movements, and I actually started developing that with Abilify. And and we determined that it wasn't necessary for me to still be on an antipsychotic. So we went to Latuda, and I think I went a little bit too high, because I was on the Prozac while I was on the Abilify, and I went from 5 milligrams to 10 milligrams and up to 15 very quick. And when I got up to 15 milligrams, I started getting severe EPS, which stands for extrapyramidal symptoms, and I just couldn't handle it. It was scaring me. I would just randomly jerk, and you'd see my hands do a lot of shaking, which they shake now, but it's not nearly like it was. But Latuda, I've had almost no extrapyramidal symptoms. I've had no signs of tardive dyskinesia, at least I hope. And that's why I'm afraid to go up on it, because I educate myself very well on these medications. And my doctor, my pharmacist, hell no. But I do know my stuff, because I'm not going to put something in my body that I don't understand what it is. And, not to say that I do make bad decisions what I put in my body. I'm drinking a Monster right now. But, I want to know. And so with Latuda, I've not noticed any of those side effects I had with Abilify. And really the only other antipsychotic I'd been on was Saffris, and that didn't last very long at all. Maybe about 3 weeks, maybe 2 weeks. I didn't like it. I started getting twitches and everything, and at first I loved it. It helped me sleep great. I was relaxed. I didn't sleep too long, but I just did not like the Saffris. I was on 10 milligrams starting out. I was on that when I was in the hospital. I was in the psychiatric hospital in Knoxville called Peninsula, and that was a terrible experience in itself. But I was put on the Saffris then, and I didn't like it. So I've only been on 3 antipsychotics, and it's because I'm just, it's hard. You can't be like that when you need them, but I'm very picky with antipsychotics, because I'm afraid of a lot of them, especially the older ones like Haldol and chlorpromazine and, whatever, Trilofan. All those older type of antipsychotics, which really, you put like 100 people in a room and give them all Haldol, about 25 people will get tardive dyskinesia. You put 100 people in a room and you give them Risperdal or Risperidone, you're giving, about 2 of them maybe will get tardive dyskinesia. And, like I said, it is something I worry about, but so far the benefits are greater than the risk. But if I start noticing any signs, I'm going to, slowly come off of it. Then the other medicine I'm on was Trazodone, which I'm sure you probably heard of that. I'm on 100 milligrams. Probably going to go down to 50, because it's just, lately I've been on a while. I don't think it's Latuda. I don't think it's Trazodone, because I've been on Trazodone for quite some time to help me sleep at night. And lately I've been excessively sleepy. I can be so sleepy during the day and not sleep at all during the day. But when I go to bed at night, I still can't sleep when I do my Trazodone. But lately during the day, I've slept, just yesterday, from 3 to 9 o'clock, 6 straight hours during the day. Then went back to bed and slept another, 11 hours, 12 hours. So it's gotten bad lately, and he's took me down dramatically on one medicine, which is the one as needed, which is hydroxyzine. I don't like it. It doesn't help. I rarely take it. I mean, he had me up to 100 milligrams 4 times a day. Now I'm down to 50 3 times a day. And I don't like it. I don't see how he might think that would be it, because it does not help me at all. It does not make me the least bit tired, sleepy, help with the anxiety or anything. And I understand, I have, certain issues to why he would not want to prescribe me a benzodiazepine. So I wish to God I could get a benzo. I mean, just to take, like maybe once every few days, just to help when I really am in panic attacks. But hydroxyzine, the other one, it's like a souped up antihistamine. And really, I feel like another antihistamine called phenergan or promethazine. I feel like that's a little bit stronger than the hydroxyzine. But hydroxyzine is supposed to help with anxiety. It's like a serotonin antagonist or whatever that's supposed to help. I think that's all bullshit, to be honest. I don't like it. So I rarely take it. So really, I'm just on 3. I'm on, the Prozac 60 milligrams, Flatuda 40, which probably go up to 60 sometime soon. And then I'm on trazodone, which I'm on 100 now, but I really want to come down to 50. And then also, the doctor wants me to see my primary care physician to get a sleep study, because he thinks that the reason why I've been so tired is, even though I sleep all night, that I'm not getting a restful sleep because of, look, I'm a big boy. I am a big boy. So when you get all this fat and stuff around your neck, you're going to snore a lot, and that could cause you to stop breathing, and then you wake up and whatever, because you're not breathing, and it's just a whole mess. So I think somebody has sleep apnea, and he wants to get a sleep study done, because he thinks that may be the reason why I'm so tired, because I'm not getting a restful sleep at night. But anyway, I know I haven't made a video in a while, and I really want to make these. I really want to get editing skills. That is the main thing I want. If I had editing skills and a better camera, I would do this more often. And also, I'd like a larger audience, but I'm not going, which I have like 3 people who watch me on every upload. 3 people. So, I mean, that's 3 people. And I love it that anybody would watch. Even if it's just one person who watches every video I make, I love you for that. That is amazing. I don't know how you can put up with me. It's beyond me how anybody could put up with me. But, anyway. So that's it for this video. Like I said, I hope to do this more if I had a better camera and I had, at least some editing skills, which I don't have any editing skills at all. So, but yeah, hope you enjoyed this video. Hope it was informative. And if you have any questions about, anything I did not mention, I will say this: for sleep, I was on mirtazapine for a while, which, surprisingly for me, it did not make me gain weight. Remeron was the trade name of it. It did not make me gain weight, surprisingly, like most people have, which I wasn't on it too long. I was on 15 milligrams. I wasn't on for too long, but anyway, that's that. That's all I can think of just saying, all the antidepressants I've been on, and also I've been on a few mood stabilizers. I've been on lithium, trileptal, and lamictal. So I've been on 3 mood stabilizers, and but yeah, that's it. Hope you enjoyed this video, and I love you, and bye.